It is normal to have some post-operative swelling just after surgery in the breast, chest, armpit, and upper arm areas. The swelling usually improves within 6 to 12 weeks after surgery. Some women who have had lymph nodes removed from their armpit develop swelling in the affected areas that persists. This swelling is referred to as lymphedema. Lymphedema may never occur. However, if you have swelling which does not improve or increases, make a review appointment with your doctor to help diagnose whether you have lymphedema and refer you to a certified lymphedema therapist for appropriate treatment. To understand how lymphedema happens, it helps to understand how the lymphatic system works. The lymphatic system is part of your immune system and helps protect your body from infection and disease. This system consists of a large network of lymph nodes and lymph vessels located throughout the body. Lymph nodes are small, bean-shaped organs that trap unwanted substances and fight infection. Lymph vessels are tubes that circulate lymph, a clear fluid that is pushed through your body's tissues to cleanse them and keep them firm. The contractions of your muscles push the lymph fluid through the lymphatic system. The lymph nodes filter the lymph fluid, removing bacteria, viruses, cancer cells, and other substances that could cause harm. The filtered lymph fluid is then returned to the bloodstream and the unwanted substances are eliminated from the body. Lymphedema can occur very soon after surgery or radiation, or it can develop months or even years after these treatments. If lymphedema develops in women who've been treated for breast cancer, it most often occurs in the arm and/or hand, but sometimes it can occur in the breast, chest, underarm, trunk, abdomen, or back, depending on the type of surgery and treatments that you have had. Injury and infection in the affected areas can increase your risk of developing lymphedema. If you are at risk of developing lymphedema, it is important to recognize early signs and symptoms of lymphedema and to take some key preventative measures outlined in your written resource. Some key signs and symptoms of lymphedema include a sense of heaviness, fullness, tightness or aching in the affected arm and/or hand or other affected areas. A sensation of stiffness when moving the elbow, wrist, or fingers. Clothing and jewelry, such as rings, watches, or bracelets, may feel tighter on the affected areas. Swelling in the affected arm and/or hand or other affected areas that persists or gets worse over time. If you notice early signs and symptoms of lymphedema, or if you are at risk for developing lymphedema, here are some important guidelines to follow. Continue to take baseline measurements of both your arms at regular intervals after surgery, and comparing them over time may help to give you a sense of whether or not the swelling is increasing. A difference of 2 centimeters or more in the measurements between your affected and unaffected arm could indicate that you may be starting to develop lymphedema. Remember to wear the pink alert bracelet to signify that an arm is either affected by or at risk for developing lymphedema. Contact the province's health line, 811, for further advice. Consult your doctor, who may refer you to a certified lymphedema therapist for further assessment and treatment. Refer to the Lymphedema Association of Saskatchewan's website, www.sasklymph.ca, for a full list of public and private certified lymphedema therapists in your health region.
I guess I thought I wouldn't get lymphedema because I had a sentinel node biopsy. But then about a month after my surgery, I noticed there was some swelling on the surgical side, particularly in my hand. And it went through my mind that, this possibly could be lymphedema.
I felt a heaviness in my arm, and I thought that I noticed swelling. Went to my doctor, and she wasn't so sure. Did some measurements, and I went back about a month later, and the measurements had increased. And so she referred me for treatment at Pasqua Physical Therapies Department. And that's where I was really diagnosed with lymphedema. They did volume measurements and discovered that there was lymphedema in that arm.
I was still in chemo 6 months post-surgery. I was called to come to physio. In that 6 months, from my readings, I knew I had needed some physio and some lymph drainage because I had shown all the symptoms and my GP had confirmed that. Now, when I first started, I could barely move my arms at shoulder length. It wasn't happening. And there was lots of scar tissue that had to be worked with and just stamina.
Physio, extremely important because you need to get the lymph fluid moving, but it's very important that you exercise in the proper manner because you can cause more damage if you do things incorrectly, which is actually what I did to start.
I was really surprised that it's a chronic condition, that it's something I'll have for the rest of my life. But on the same hand, then I was also taught to recognize what triggers the lymphedema. So I know for me, it's heat or excessive amounts of exercise. I was taught to do manual drainage myself.
There's actually quite a lot of self-care involved. You need to do things daily, pretty much, and it's pretty hard to go to a therapist every day. So the therapists generally teach you how to self-manage.
The physiotherapist plays an extremely important role in your back to work life, in your communication with your medical insurance. What the physiotherapist brings is that understanding that they may not have, and the rationale for why perhaps your return to work goes slower than the normal. You had surgery, 6 weeks recovery, you go back to work. It doesn't work that way with breast cancer.
Dealing with lymphedema is like any other chronic condition. If you had diabetes and you stopped taking your medication, there'd be an issue, right? So with lymphedema, I wear my sleeve. I do the manual drainage when I have flare-ups, and I keep myself reminded of how to do all of those techniques. I eat well, I exercise.
It's really important as a breast cancer patient that if you think you are having signs of lymphedema, that you go to your physician and ask to be referred to a certified lymphedema therapist. You may have to be fairly assertive because not all physicians recognize the signs and symptoms of lymphedema. But it's very important that you get early treatment. If you are diagnosed at an early stage, it can be reversed.
Lymphedema usually develops gradually over time, and the swelling can be mild, moderate, or severe. There are also 4 different stages of lymphedema. In early stages, the swelling is mild and usually improves easily with elevation, gentle exercise, massage, and the use of compression garments. In later stages, the swelling may get worse and tissue changes or damage can occur, which require more intensive treatments to reduce. It is very important to seek early treatment to avoid worsening of the lymphedema. However, regardless of the stage of lymphedema, it can be manageable with appropriate treatment and maintenance care. If you've been diagnosed with lymphedema, there are treatments to reduce the swelling, keep it from getting worse, and reduce the risk of infection. A certified lymphedema therapist has specialized training in complex decongestive therapy, or CDT, which is the standard treatment for lymphedema. It is considered to be safe and effective and usually consists of 2 phases: an initial phase to reduce the swelling, followed by a maintenance phase to control and maintain the swelling. CDT can significantly improve swelling and symptoms, maximizing function and quality of life. Manual lymphatic drainage is a hands-on, massage-like technique that improves fluid removal from congested areas where the lymphatics are not working properly into lymph vessels and lymph nodes that are functioning normally. Manual lymphatic drainage can be performed by the therapist as a treatment, and the therapist will also instruct you to perform self-manual lymphatic drainage on a regular basis at home to help manage your lymphedema. Manual lymphatic drainage can also be applied through the use of lymphatic pumps. This consists of a pump which supplies air to garments which are worn over areas of the body to be treated, producing a massaging effect in the sequence of manual lymphatic drainage. Your therapist will assess whether the lymphatic pump is an appropriate addition to your treatment plan. Compression bandaging is a special technique that uses multiple layers of short stretch bandages that are applied to the affected arm and hand. The bandages are applied with moderate to low tension, using more layers in the lower portion of the limb and less towards the top of the limb. The layers of bandages help to create a pump-like action to move fluid out of the arm and into the functioning lymph nodes, causing the swelling in the arm to reduce. Compression garments can be used during high-risk activities and for the long-term management of lymphedema. There are many different styles and compression levels of garments, and your therapist will properly assess and fit you with the appropriate garments for you. You may require day garments only, or you may require the addition of a night garment, depending on the stage of your lymphedema. Your therapist will instruct you on how to don your garments on and off and how to properly care for your garments. Specific exercises are taught to patients with lymphedema by their therapist. Usually, compression garments are worn during these exercises to help counterbalance the buildup of fluid in tissues from activity. Meticulous skincare and hygiene is recommended to help minimize your risk of developing an infection in your affected arm and hand and other affected areas. Your therapist will provide you with guidelines for proper skincare and activities to help reduce your risk of infection. Cellulitis is a common infection of the skin that requires antibiotic treatments. If you notice signs of infection, including increased swelling and pain, warmth, redness, or a rash-like area in your affected arm or hand or affected areas, contact your doctor immediately for treatment. Since lymphedema is a lifelong condition, patient education in self-management is very important. The important areas of self-care that are taught include risk reduction practices, self-manual lymphatic drainage, skin care, signs and symptoms of infection, proper fit and care of garments, and the importance of good nutrition, exercise, and weight control.